Hi, Craig. Welcome to the Integrative Health Coach Success Podcast.
Hey, how are you doing? I'm so excited to be here. I got goosebumps just from our previous conversation and getting ready and talking about what we're going to be doing. And I just am so excited to share my story as well as hopefully inspire other people to try to create their own passion and have their own way of healing people through Equal Life and other modalities that they can put together.
Yes. Yeah. We're really grateful to have you. We've been trying to get you on here for quite some time. So long time coming. I heard you speak at RHS and I was like, we got to get him on the podcast.
Yeah, thank you.
He was made for this.
Thank you.
For those who don't know you, could you share a little bit about what you're currently doing with your IHP certification? And then I'd love for you to kind of back it up and maybe tell us how you found IHP and what led you here.
Sure. This may take a few hours, so everybody buckle up. You ready? So I'm going to start with what I'm doing with my IHP now. So I am IHP 1 through 3. I've done all the certifications. I've I've done high performance health. I've done the mastery program. There's pretty much nothing that I haven't done within the IHP, and ventured into all the Equal Life products and protocols and services and everything else. So the way I started it was through the podcasts, Dr. Cabral's podcasts. That's how I got hooked on him, and hooked into his mission and the belief of what he has and how he's putting it together. It sort of excited me because we have a common theme, let's just say a common mission in helping people. It's just different. And I think that's what makes everything unique and synergistic, is being able to have your own unique way of helping people, but also then bringing in the right background, sort of like the Equal Life and then the other IHP, synergistically bring them together so you can help more people and have more what I call the wellness recipe to help people heal. I always talk about healing better, feeling better, living better. That's like our motto. And it's like you have to be able to figure out ways to heal so that you can feel better, and then you'll definitely live better. So that's been my motto before I started this business over 30 years ago. And it sort of took on its own identity. I'm just going to say 10 years ago. It sort of it got boosted with steroids because we started doing a lot more modalities. And when you open up something, for instance, offering supplements and or protocols or different things to other people, all of a sudden people seek you out. They search you, they find you, and your funnels become full because people are looking for you. You're not just looking for them. Yes, we're educating them. Yes, we're showing them what they can do, trying to educate them on what we do and what we offer through Equal Life and IHP. But it's more like now people are starting to seek out health, seek out ways to be able to be healthier and have more vibrant life. And that's why I go back to the feel better, because you need to feel better or you're not going to break out of your sort of your strains and your stress and the things that keep us in disease. So that's how I got to where I am now, with the vitality of creating a system and creating a recipe for people and then building on it. So IHP, I started out with 1, loved it, went right into 2, and then went into the high performance health and mastery program, which I absolutely love. I would highly recommend both of them. Mastery was amazing, literally life-changing for myself and for my clients and even for my staff, because we practice what we preach. But mastery, I would say, was probably one of the things that changed my life the most in a sense of education within the realms of what IHP offers. High performance health was more in my wheelhouse in a sense of, superhuman protocol and taking care of myself. I've listened to Anthony Robbins and, all the motivational guys since I was a little kid. My mom used to say, why are you not reading books? You're reading only self-improvement. And I'm like, well, because that's what I love. I love it. You know what I mean? So going way back to when I was growing up, I always had that urge to be healthier, to be better, and to help other people and motivate other people. I tell people I've been self-employed out of the womb. I've always been self-employed my whole life. To get back to your question, I know I'm going to ramble a little bit here. So going through all the certifications, and actually when I just finished level 3, I was so excited for all this information and all these tools that we have that I'm like, I got to go back to 1 now and relearn it again because it all makes sense. It's like you go through the levels and jumping through the hoops. And now that I've got everything, all the different tools that are there and access, which is amazing, lifetime access to all your information is just incredible. I'm going back and I'm learning that big beginning, even though the beginning part was easier for me because I'd been doing something similar for the last 30 years, educating people. I started as a massage therapist 33 years ago. I've treated over 100,000 people myself personally, as well as had 15 massage therapists in my practice and 3 offices. So I've always been sort of in that field. And then about, I'm going to say 20 years ago, I bought a hyperbaric chamber and then a ozone sauna and started adding tools, and then more different type of population of people would start to come, and then it would build on top of, and then I'm going to just round it off at 7 years because I was at the second round table, the health summit, which was just at a round table. I think it was after Australia. And that's when I sort of jumped in and have been going to the health summits, got intertwined with Dr. C, Carl, who's an amazing mentor, and he has a bunch of different great insight on the growth of the business and things that we can do. And then within that, just learning and using the tools like all the podcasts and the different tools that they have. I mean, there's so many more now, but back then it was mostly just the podcast. I would just give people podcasts. I would give them the Dr. The Cabral podcast and go, you need to listen to this. You need to look at this. And then I would use my verbiage and sort of explain what it was. And it was easy. It was so easy. And then finding out what people are deficient in. Okay. And then educating people. We should all be doing detoxes every year, the 4 quarterly detoxes from functional medicine in upstate New York. Well, pretty much everywhere now. Mold. So I do a mold every year. I do a parasite every year. I do a heavy metals every year. I use the tools that we have. I have the stock of a lot of the supplementations. I'm 63. I turned 63 yesterday. So
happy birthday.
I feel stronger and more powerful and more alert and have more direction than I ever have in my whole life. Wow. And it really has a lot to do with the systems that are set up with IHP and Equal Life. I mean, it really does. I mean, there's not a morning that I miss my Cell Force or all my supplements and my drinks, my greens and my protein. And I mean, all the different things. I literally have it all laid out, and it's every morning and then every evening and then, well, and lunchtime too, but mostly mine are like 5, 6 o'clock. But it's learning the systems for yourself, basically just educating people that you see. And the more vibrancy you have, the more people are attracted to you. So I'm going to finish up with your question here. So how I'm using IHP is more, it's added on to the brick and mortar we have, and we have hundreds of people a week come in to use services. So I'm able to educate them, get them information on different types of protocols and supplementation they should be doing, the testing and those types of things that we can do to help them find what they're deficient in and or what they need to be doing. But one of my skill sets, as I'm going to say, is sort of diagnostic, and because I've treated so many people, I mean, we're talking hundreds of thousands of people over the years, that you sort of know where they got to start. And this is why I said I'm going to round it back out, going back to number 1. So I got all the education. I know all the different things to do, but it's really going back to 1 and changing people's lifestyles. It's the hardest thing to do. It's the hardest thing to do, and educate them and get them so that they're taking their choices into their own hands. And I think, did you do the podcast the other day on helping the questions you ask your clients?
Yeah.
So that was so impactful because it really is empowering your clients. And that's why I'm like, I need to go back to 1 and learn all these different things again and sort of put them into all the different education that I've gotten through all the other courses. And it's just, it's endless resources. The hubs that you guys offer, and after the courses that have all the flyers. I had a woman in one of our hyperbaric chambers the other day was texting me, and she goes, what do you know about histamine? What do you know about histamine in foods? And I'm like talking to her texting on my phone. And as I'm going to the hub in level 2, and printing out all the flyers for the histamine foods and the different things like that. So it's like, it's like literally having everything at your fingertips.
And from a trusted source from somebody that you know has researched, it up and down, and someone that you trust, like Dr. Cabral, who's done all of that legwork to kind of provide you with the confidence to be able to deliver that information to clients. And then they're looking at you as the expert and, the trusted source. Right.
So I tell my kids all the time, I have twin boys who are 27. I'm like, it takes you 25 to 30 years to have an overnight success. So I'm like, so just so you know, you're still on your way and you're not where you want to be, but you're on your way. And I'm like, and as I said earlier, we are just getting started here, literally just getting started. And it's just so exciting to see people come in, and especially post-COVID, and be interested in their health more than ever. And it's just like, okay, I want to feel better. I don't want to rely on this medication or this type of drug or whatever they're going through, or they need support through that treatment protocol they're going through. But you have answers. And I tell everybody, I call Dr. Cabral my mentor, and I say he formulates everything. I trust him. I go, there's so many products out there and so many people that you can tell you all this information. But I truly believe, because his heart is in the right place, his mission is in the right place, and his passion is in the right place. Those three, it's like a trifecta. That synergy allows me to be confident in what I'm promoting through IHP and through Equal Life.
Yes. Yeah. That's what a good leader does, right? Leads confidently with knowledge. And and I love the point that you make about, how lifestyle is the hardest thing to change for clients. But oftentimes that's the thing that honestly bursts a new human, right? Like if we can get a client to change some lifestyle habits, usually they have some limiting beliefs, some things that they have to overcome in order to do that. Right. Oftentimes it's the new person that kind of emerges from that makes us, that work so worthwhile. Us get even more excited. And I love that you brought that up, because it's easy to take a capsule. It's easy to drink a powder. It's easy to, do all the things that we can just easily do. But in order to change some lifestyle habits, we do have to think differently, act differently, become sometimes someone entirely different in and of itself, to make different choices, to love ourselves in a different way and stop sabotaging and whatnot.
Right. I mean, Dr. Tony talks about that. He and I've had multiple conversations. Like, the first few things they do when a person goes to Hope for Cancer is spirituality and mindset. Mm-hmm. It's changing your mindset. It's getting rid of the stress. It's looking back at traumas and things like that, and trying to figure your way out of the diagnosis you're in, or the whatever it is that you're going through, your journey that you're going through.
Yeah, absolutely. Yeah. What I would love to dive into next, because it is more common for our IHPs to have, online practices and be doing things, they're putting emphasis on social media and all of that. What do you find to kind of be one of the best things about a brick and mortar? And you had it before IHP, and it seems like that's just supercharged it. But what does it mean to have that versus, a mostly online based service? And what kind of, inspiration can you offer others who think that like a brick and mortar might be for them?
Right. So it's definitely a different animal, obviously, going to a brick and mortar. I like to tell people that I see miracles every single day. There's not a day. I'm here 7 days a week. I love what I do. This is a second home. My wife will tell you it's my first home, but it's my second home. And we literally see miracles in the clinic every single day. Using the tools that we offer through IHP or Equal Life, or the tools that we offer in our clinic. And the way to start, I think, is how I want to approach this is, and I'll tell you the way I started, let's just say. So 30 plus years ago, I became an orthopedic massage therapist. I set up in a chiropractic office. They started feeding me clients. We decided to try to create more of a wellness facility. This is one of the first offices that I opened. I've had like 6 or 7 offices, but it was networking. It's all about networking and planting seeds, and not necessarily not taking no for an answer, but not taking no as a negative. It's like, people don't know what they don't know until they know. and you need to educate them that. So I've had multiple offices with chiropractors. I've had multiple offices with, Reiki practitioners and nutritionists and doctors. I mean, we've had shared offices with different doctors and different practices. So it's been more of like weaving in and weaving out, but it's always trying to educate, going to meetings. Like even now, I mean, I'm 35, probably 30, 35 years into this business. I just went to a networking meeting the other night with a bunch of functional medicine docs and their practitioners and different people in their practice. And you talk and you listen, and then you educate them what you do, but you also listen to what they do. And that's one of the key parts, I think, is like the other day I met a new functional medicine doc who takes care of women's health care. And she was amazing. And she educated us on what she does and how she does it. And now I'm texting back and forth with her with specific clients because there's only so much I can do. So again, the networking component of it helps. I mean, it helps virtually or brick and mortar. I reached out to every gym in our city. I reached out to every massage therapist, every acupuncturist, offered them to come in and see it and sort of take a walk through our clinic to be able, because people come in and they're just like, they don't know what these tools are and how they can help them, and then synergistically how they can work with what they already have. So maybe they're on a supplement, maybe they're on a specific diet, maybe they're going through a specific treatment protocol of some sort, be it post-surgical or cancer or Lyme disease or autoimmune issue, whatever it is. It's finding the right tool, recipe that's going to help them be able to have the best quality life that they have. So what I have found, having a bunch of different services in our clinic, that people will come and try different ones so we can find out, okay, how does this red light work with you? How does this, infrared sauna work with you? How does the cold plunge, the exercise with oxygen, the hyperbaric? Okay, let's get you through a functional medicine detox. Are you coming for weight loss? Are you coming for some type of chronic pain or, autoimmune issue? Whatever it may be, you can sort of weave your way in and out of these wellness recipes, these wellness design sort of treatment plans. And then it's all subjective. I mean, yes, we can test and we can find things, but certain times there's that missing link. And that's the coolest part about trying to put it together for people, and why I say we see miracles every day, literally miracles every day.
Yes. Yeah. And I think from like an energy standpoint, having all of that belief, hope, right, in a place where it lives 7 days a week. And, you had mentioned like you no longer have to find people, they find you, but that's because there's like so much energetic beauty radiating from your mission and your actual like physical location itself, right? If you believe in this, which I absolutely do.
Yeah.
Now it's attracting all the people that need it, right? And that have to hear what you have to say. And I think it further builds. Right?
Yeah.
It builds. It's a snowball effect in the sense that the more people that are there now, they feel a part of a community. They can't help but to tell other people. And I think it's one of the things that is missing so much in our society, because so much is virtual that like you can hug someone on the way out the door.
Exactly. Yeah.
And, I can, get emotional and cry, and a client will know just how much I care. But I think like physical touch, a handshake, a hug, like a high five, right? Just being in someone's presence, I think has so much power, especially in a world where we are deprived of that, in my opinion.
Totally get it. I'm getting goosebumps for you saying this, because we have little kids that come in, because we treat kids with autism or on the spectrum. And so like they'll be 3 or 4 years old, and I get down on my hands and knees with them because I don't want them to feel like they're in the land of the giants. And so when they come in, I get down there and I'm high-fiving them, and I'm like loving on them in a lot of ways. And then when we get them into our hyperbaric chambers, they get in, and it's like a fort for them. So they love coming in now, but in the beginning, it's a little apprehensive. So it's like finding those tools. It's no different. Finding those tools to engage with each level client. Doesn't matter if they're 2 or 3 or 90. And same with like being virtual or brick and mortar. You find your tools and your expression on how you connect with them. So for instance, I'm a huge toucher relationship. Like I need hugs. I need to be energy exchange, that type of thing. I can get that through a virtual call in a sense of like excitement
Yeah.
But when somebody walks in our clinic and they're suffering, and we take them into one of our rooms and we cry together, or we talk to them about their lifestyle and personal experiences, where we try to direct them in the right direction. So we have therapists that we refer to. We have pretty much every type of modality that there is. We have somebody to refer to if we can't do it. But it's that experience that makes me thrive, that literally makes me every single day wake up with excitement and vitality and energy to get up and go in and help people. And it's definitely a calling. But I believe, and this is why I love the Health Summit, I see people all the time there that are just getting started or started. I mean, there's some hugely successful IHPs out there that are virtual, but they have excitement. They create the excitement in their personality and how they communicate and what they're doing behind the screen. And it's so that part of it is where I feel like, okay, that's sort of like what I do with the brick and mortar. Like trying to educate people, trying to show people your lifestyle and your excitement and the personal side of who you are, and then portraying that out into the universe, so to speak, through our technology, but also the excitement. It's like you need to motivate people.
Absolutely.
Yeah.
And I think the brick and mortar allows, just for people to receive that in a different way. It's not to say you can't create that same feeling with if you have a virtual practice, but I think the point that I would love to make to those listening is if you are like Craig and you feel like that is something that fuels you. So if being able to hug a client or high five them or, get done on a little kid's level, if that fuels you, it's going to fuel your business.
Exactly it. Yeah.
That's what makes your heart beat. That's what's going to make the heart business beat. And it might be worthwhile to think about moving into a physical space, because if you're doing what kind of makes you tick and what makes you thrive, that's only going to create more attraction, more energy, to your business. That's how your mission is aligned. And for some people, they feel completely aligned in a virtual practice. But if someone's listening and is resonating with what you're saying, I think that that's a good way to decide, is a brick and mortar for me, or am I fine in a virtual practice?
Right. And that takes me back to one of the things I wanted to say in the beginning is that I didn't start by just going out and renting space. I went out and started talking to people and doing and going into chiropractors' offices and going and finding nutritionists and going out and finding different people in the community that I resonated with. I even set up a chair massage and a vitamin aisle at our natural food store just so I could start touching people, you know what I mean? And getting people and just to get that visceral experience going. And then I moved in, like I said, with a couple chiropractors. Then I took over space in that building, and then it slowly grew. I mean, we had 4 offices at one point, and then we brought it down to 1, and now we have 4 suites that we have at this one area with all our modalities. But it was not, you don't want to bite off more than you can chew, because you don't want that stress factor. You want to go in and you want to create your environment after your personality. I think it's Trisha Irving. I've seen some of her podcasts or whatever, and when she's talking online and everything, and she's created an amazing space there where you look at when she's talking to people, and you can just sort of see and resonate with how her energy is. And there's a lot of IHPs out there that are just like that. You just resonate with what they are doing. So again, small little steps a lot of times in the beginning while you're getting educated and while you're trying to put this all together. And then it just sort of grows, like you were talking about. Actually, when you were explaining that, I was like thinking it literally brick and mortar, one brick on top of another brick on top of another brick on top of another brick. And that's how you build it. That's how you build your community. And community is the key factor.
Mm-hmm. Yes. Yeah. Absolutely. Because even I know lots of coaches who are very successful with building online communities, and, women that, it's 30 women in an online community where they meet, once a week or whatever. And it's that aspect that so many people keep coming back for, because it's okay. You all think, talk, walk like me. You have the same goal as me. You have the same mission as me. Right. And it's a way to feel like we belong, because that is a basic human need, to feel belonging, to feel connection. Yeah. And again, I think in such a more isolated world than ever before, we're checking out in grocery stores or stores, with not even talking to an attendant. And there's just so many personable interactions that have been taken out of our day to day, that I think more than ever, making health about connection, whether it's virtual or in person, is so important.
It's huge, huge. And again, I want to reiterate something you just said. You can get that connection virtually. Because I said that one of the things that came out of COVID was our world's a little bit, it's virtually connected now. There's people that are like my partner in Mastery was from Switzerland. So Manu was his name. And we connected amazingly through our Mastery program, and we still are connected, and it's all through social media. You know what I mean? So again, there's certain tools that have come out of it that are great and are useful. But you have to be able to make that connection. If you're not thriving, if you're not getting love, if you're not getting excitement, if you're not getting what you need to be fed and fueled, then you can't feed and fuel somebody else.
Yes. Yeah. And I recently interviewed Vanessa Grutman, who also spoke in RHS, and we were talking about how when we make it about ourselves, that's when we lose the connection. That's when we lose the mission, right? You know, for someone who's posting on social media for likes and views, and we're no longer doing it from our aligned purpose and our aligned mission.
Right.
I think so many of the IHPs who are electric all share one thing in common, and it's that they have literally been put on this earth for this mission, right? It's why Dr. Cabral has been as successful as he is in creating things like IHP and the world that he has, because it is his soul aligned mission. Right. It was what was there for him when he was sick as a young child. And so I think when we're aligned with our purpose and our mission, and we honor that, and we're not doing it from this place of like, okay, I got to check off these business strategies and like this. Yeah. Think about what feels good to you. Does being in person and seeing someone walk in the door feel good? Does the simplicity of being virtually feel good, right? You said it's not like you don't want to open a place that's going to cause stress. Yeah, no, you don't want that, because that a stressful business is not going to feel, very electric or energetic for someone to step into. So really getting honest with what your mission is, what would feel best as far as, being in person or being virtual, I think is the honesty that is the most impactful.
Right. Well, and also I tell pretty much anybody that comes and works for us, and or anybody that I mentor in whatever profession it may be, I always tell them, you need to go get experience. So you need to use all the tools. You need to go through the detox. You need to go through the supplementations and sort of figure things out. You need to use the tools that we have here in our clinic to be able to express how they make you feel and or how it's used. Get that visceral feeling. It's the same type of thing. You got to find where your alignment is so that you can create that fueling. It's really more, it's like goes both ways. Like you got to fuel yourself and then you fuel somebody else. And that's how the fire starts. That's how you get people on fire to change. So.
Absolutely. Yes. When I was personal training, because my story is I was personal training at Dr. Cabral's, at his physical, the brick-and-mortar that he had that was a personal training studio. And then he opened the wellness center, and I was at both. But even back then, we would have to do the workouts. Like, you need to know how this workout feels in order to put a client through it effectively. If we're going to recommend these supplements or this protocol, I want you to do them so that you understand what you're recommending to the client. One, how good you'll feel, maybe what symptoms came up, but you're able to connect to clients when you kind of walk the walk and talk the talk too.
Yeah, exactly. Yeah, that's the way it is in anything, really.
Yes.
Yeah,
absolutely. Yeah. I think, no matter what you're talking about, it doesn't have to be health and wellness. Yeah.
And it's the funny thing is, that's when you were just saying that, I'm like, that's why I'm going back to level one. I got to reiterate a lot of the things that you sort of lose. You know what I mean? They made you excited in the beginning, but I use every single day. I use those tools every single day with people.
Yes. And you go back and listening to that information, you'll actually probably listen to it in a whole new light now, knowing all of the specialized information that you know now, right? Like a lot of the conversation can sound or be internalized differently when you know the extent of your knowledge now, because you didn't have any other knowledge aside from one the last time you listened to it. And now it's like quadruple that.
Exactly. And it really sort of solidifies the whole journey. I mean, it really does. I mean, all the different things because I can go back to remember sitting in this room or at home or, somewhere else, just staring at the screen, going through the courses and answering the quiz questions and learning it and learning it and learning it. But you're learning it. But now on the other side, going back, it's more visceral. It's more inside me. It's more what I know and what I can regurgitate, not just me saying, okay, this is what this is right here, so it's nice. And we've actually, in the clinic, we have a bunch of binders that have tons of information. So like if somebody comes in, again, I can take them right to a binder, show them everything that's in one of our IVs, every supplement that we have here from Equilife or Protocol, and it's in big writing so people can read it. You know what I mean? And fly through it and talk to them and educate them, just like you're having a conversation about what this is for them. And I do it online too. I mean, I can virtually talk to somebody and sort of do the same type of thing. It's just that I'd have to say 90% of what I do is obviously brick and mortar. So.
Yes. So I don't want to over romanticize brick and mortar because my dad ran a pizza store for a long time. I saw how hard Dr. Cabral worked at his brick and mortar. So what is the hardest thing about running an in-person practice of your magnitude at this point? Or maybe the hardest thing about getting started?
So there's two different answers to that. The hardest thing getting started is it's just you usually. Mm-hmm. So, I mean, everything is you. You clean the bathrooms, you decorate, you create the systems, you bring in the tools, you create the online presence or whatever you're trying to do with your practice and emails and everything else, and then reaching out to the community. It can be a little overwhelming because it just feels like it's you. If you have a partner or a team, it can be a little bit more supportive, but it's still the same work. And then as you grow, that part gets a little easier because you have the system behind you, have people behind you, have testimonials, things like that. Then it's the employees, so, which is a constant struggle in a general sense. I mean, especially because we have nurses and admin and techs, and the idea is to get the team. I mean, you want to build the team like Equilife and IHP. And this is what I tell Carl and Dr. C all the time. It's amazing to see the team that you guys have put together just because there's synergy that works with it and how it's growing. That's, I would have to say, is the second hardest thing in a brick and mortar is you have hours that you're open, let's say 7 to 5, whatever it is. You have to have it staffed. You have to be answering the phones and all those things. So those little details can create a little bit more stress just because of the growth pattern. For instance, I have to be doing certain things. And I mean, I still clean the bathroom here and I still change out the toilet paper and I still do the paper towels and do some of the cleaning and stuff like that because it's part of the gig, but it's growing and finding the right people to surround yourself with. So that in turn is the same as the community. You got to find the right people to surround yourself with in the community because you can have people that are taking from you and draining you in the community that you're creating. In your brick and mortar, you have to find the people that are supporting you and are able to create that atmosphere in your brick and mortar where people want to come in and feel accepted and feel loved and feel not like the people that are here are knowledgeable. So that is probably one of the hardest parts because you weave in and out of people's personalities and you will, I say, kiss a lot of frogs. You actually, you end up having a bunch of people that might not have worked out as long as you can make that cohesive, that like say, okay, this isn't working. Let's move on. And we've had a lot of those, but again, you get into the sweet spot. Like right now, I've got amazing staff, amazing nurses, everything else, and it just feels so good. You know what I mean? It's like, this is why you work. That's why I work hard. And then I come in and I use the services too. So having a brick and mortar, I mean, we have there's not a tool that I really don't have. I have 4 different red light saunas. I have cold plunge, exercise with oxygen, hyperbaric, IV therapy, brain health therapy, ozone saunas, PEMFs. I have injury prevention and recovery tools where we're doing orthopedic applications to recover and strengthen muscles and things like that, and cupping and massage and all these fun tools, let's just say, that I can take advantage of. So again, blessing.
Cleaning the bathroom's a little less
glorious.
Yeah.
But again, it's
treat yourself after.
Exactly it. Exactly it. It is, the reason I say that is because it's something that everybody brings up, because when you're in a public place, it's just, people are just not as clean as you want them to be, and it's just sort of funny that it's oh, that's one of the reoccurring things that just goes on in a brick and mortar. So, but to go back to what you were saying, it's small steps. You want to take small steps. You really want to have a vision. So vision board, I tell everybody, do a vision board, journal, write these things down, because you want to be able to go back and sort of express yourself and go through that and see where you were, so you can tell where you're going. And then have good connections, know where to find the energy you need, know who you need to call, who to ask. I have people on my text threads and my texting and my calls that I can text, like, hey, what do you do with this? What's going on here? You sort of network. And I know a lot of IHPs do that. Like, I just was texting earlier with some people I met at the Reimagine Health Summit, and just saying, how you doing? What's going on? You know what I mean? Just the support that's there because of the community. Yeah. And that sort of happens within the community of a brick and mortar. So like the juice place down the street, we do a lot of collaboration. We have people that come in from gyms. We have people that come in from like other doctors' offices, or, just any venue, so to speak. And then use the different services, might be one or two of them, but then they go back and they talk about it in their facilities, and it creates that conversation and community.
Absolutely. Yes. If people are listening and they want to connect with you further, or they want to check out your space, where are all the places that you show up, whether it be social media or a website, or where is your brick and mortar?
So your best bet is go to truefunctionalhealth.com. Is truefunctionalhealth.com. It educates you about a lot more. We're in Rochester, New York, so we're upstate New York. Like I was saying earlier, we do have people drive 3 hours at a time to come here and do multiple services. So it's not like we just are hitting our market in the Rochester area. We are expanded out. You can reach out to me. I'll even give you my direct cell phone number. It's 585-703-4483. You're better off texting me, though, before you call me. I don't always answer. But I'm an open book. I would love to help people, and I have passion for this. So there's nothing that I hold back. I actually help people open their own businesses here in Rochester that people would consider like competition. I'm like, there's no competition. There's really no competition anywhere in any of these fields, because so many people need help. So many people.
Yeah, I love that viewpoint, because it really is. I mean, the other mindset is too much of a scarcity, and that's why you have a thriving business, because you believe there's enough for everybody. So everybody. I think that it was probably 15 years ago, one of the chiropractors here in town started doing hyperbaric, and I wrote him a letter, and it was actually a she. I wrote her a letter and said, hey, so excited that you're becoming part of this community, and if there's anything I can do to help you, just let me know. I didn't really know her. I knew her dad, who was a chiropractor, and she was an acupuncturist, actually. And I ended up buying their chamber because it didn't work, because it didn't work in their facility. But it's just that you have to embrace every avenue, and you have to look at things so that it's expansive and not allowing you to grow. If you're not growing and you're not helping other people grow, then you're not healing. And the main part is you need to be healing. They need to be healing, so that everybody together is going forward and growing together. There's so many people out there that don't want to give out all their information, doctors, practitioners, whatever it is, because there's a fear factor in there. And that can cause disease. That can cause people to have like anxiety and stress and things like that on both sides. So I think one of the key factors for anybody, virtual and or brick and mortar, is just to live with excitement every single day. To work on yourself every single day. I mean, it takes a lot of motivation, let's just say, listening to people. I listen to a podcast right now called Radical Remission, and it's amazing. The stories people have, it's just, I get goosebumps, and I almost cry during these podcasts. They actually just endorsed Dr. Tony's new book, The Women Who Started This. But again,
if you're not feeding yourself excitement, if you're not feeding yourself health, if you're not feeding your brain, your heart, your lungs, every visceral part of your body, health, wellness, and positivity, then you're not growing.
Yeah. Yeah. Absolutely. Couldn't agree more.
Yeah.
Thank you so much for being
You're welcome.
Integrative Health Coach Success Podcast. This was such a great interview. So happy I got to know you a little bit better. And I'm sure our listeners really enjoyed it.
Thank you so much. My brain wants to like say so much more. Because I want to get my excitement. So I've been waiting so long to do this. I told her earlier that I've been procrastinating doing the podcast, but I totally enjoyed this, and thank you so much for letting me be part of it.
Yes, our pleasure. We'll look forward to talking to you soon.
All right. Thanks.
Craig.
All right. Bye-bye.